So often people don't go to that process, and that's the problem when you go into the chronic pain loop. It's probably the same thing as a start. Let's say you have an injury, you know, Saturday you were in the garden, did a bit too much, and now your back is hurting as well. But the difference is that you don't know what to do with it, and probably you see somebody who is not educated with the newest rehab protocols we have. Some even, unfortunately, some GPs tell you to lie down for a week. What's happening if you lie down for a week is that you usually get stiffer and you have more pain, and the other big disadvantage is that actually you're wasting 15 to 30% of your muscle mass when you just lie down and relax for 1 week. That's sometimes even the problem when somebody has a flu, you know, like they decondition quite fast. But now let's keep the problem on the back focused. So the lack of rehabilitation, the too long rests, so we normally rest 1 to 2 days and then start to do some movements, and we want to regain normal flexibility, normal mobility within 1 week to 10 days. As if you're resting for a week, that's going to take much longer to then get you moving. Obviously that is reducing your strength, like we said before, your endurance, your mobility more, and then people think after a week of rest then they can go back to work and probably even play some sport again. And what's happening then is, because everything got stiffer and weaker, the structures overused. So they overuse their muscles. The muscles are not ready actually to be loaded so much. They are not ready to react fast enough, and then they re-injure themselves again. And then they go back to the doctor, then they have a bit more rest, and the whole vicious cycle starts like that. So instead of having their back pain sorted within, normally it will probably take 3 weeks to 6 weeks. It can take up to 3 months, but usually that's a normal thing. If somebody comes in early enough, we have it sorted sometimes even within 1 week. So it depends a bit on what it is. But if the prolonged rest happens, the mobility is reducing, the strength is reducing and everything, that's the start of the chronic pain loop. And with it as well, the behavior starts changing. That's that pain, fear, avoidance. So you're learning, your subconscious mind learns that when you do a certain movement, then it's going to be painful. And because you're learning that pain loop, you're further reducing your mobility, and the more we reduce our mobility, the less we do. Obviously we decondition even more, and the weaker we get, the more pain we have, and that reduces the whole social life. It reduces your ability to work, and some people even end up with depression and anxiety. So that's that chronic pain loop. So sometimes I even tell people, you know, like, your brain is so used to the pain that you can be in a comfortable position and then just think about, let's putting your socks on, for example, and then people already feel pain without actually doing something. That's the conditioning of the brain. And we start to understand a little bit more on how that works and how tricky it is to get out of that pain loop.